Welcome to PTNow.
An important component of PTNow is the ability to search efficiently and to search richly. So we have collaborations already with many groups that have initiated the collection of evidence-based resources. So rather than you having to go to their site discreetly, you can enter that through PTNow. So we're already connected with Stroke Engine, for example, which has a rich repository of clinical summaries and guidelines for practice.
The value of a clinical summary, we really hope, is that very quickly a physical therapist who can access the information related to a specific condition that they're treating, and they can really say to themselves quickly, what are the best testing measures I can use? What are the most predictive outcome measures that I can use? How can I quickly evaluate this patient, have the right data that I need in order to assess change, assess progress, and really blend into my prognosis and expectations for the outcomes of this patient? Having that information synthesized in a way that you can quickly access it, and actually having the tested measures there for you so you can print them out and perform them quickly, is really a way of making it more practical to utilize evidence that's available in a synthesized and complete way.
Well, I think one of the most important aspects of the PTNow site is its interactivity. We need to have communication between the developers, between the users, and amongst the users, because we in fact are our best resource. So what we want to do is be able to replicate being able to go to the booth next door and talk to the expert clinician, or to just your colleague and get the information. So under the community tab, we've created several resources for communication. One is a discussion board that will be tracking each individual clinical summary, and the others are the kinds of features that you would see on a social networking site that will allow you to sort of bond as a professional community as you develop your clinical reasoning skills, as you enhance your practice, and hopefully as we as a group decrease the variability of practice by sharing best evidence.
And wondering what a clinician wants to know quickly, that's really where feedback is going to become critically important. So do you want to know what your patients are reading in the news or in a news journal? Do you want to know what the latest update on a drug is? Or do you want to have that synthesized a different way and sent back to you? Really giving us information about how this will be best utilized in clinical practice will shape the site, and it will actually allow us to provide you information in a more effective way.